Hi, I'm Dr. Tom Babu, and I'm a consultant endocrinologist and medical director at Silverline Hospital, Kochi, India. Diabetic patients, if you look at our demographic profile, most of our patients are in the elderly group. Means at least till recently, we thought that diabetes affects middle-aged and older patients to start off. So that is the demographic profile. So therefore, to start off with, diabetic patients are at a disadvantage from the age point of view. So that itself puts an average diabetic patient at increased risk of being afflicted by the coronavirus. Now, despite the adverse demographic profile, but by virtue of somebody being a diabetic itself, is an immunocompromised state. Means that the immune system is not up to scratch or not ready to go in terms of the overall, let's say, when compared to the general population, and especially the younger population. An average diabetic to a normal young adult, their immune system is definitely compromised, and therefore they are at an increased risk of getting infected by these viruses, especially in this case, the novel coronavirus or the COVID, as it's known today. So certainly, and even if you look at data coming out from Wuhan or be it in the US and Iran, you can see that among people who succumb to the disease, they seem to be diabetic patients, and actually not only are they diabetics, and they seem to have poor control. And so therefore, they are in particular, they are at risk for the disease as well as death arising out of it. These are the times where a diabetic should keep his blood sugar levels very well alluded to earlier. There is a chance that uncontrolled diabetes itself will put these diabetic patients at increased risk of morbidity and mortality. So therefore, during these trying times, there should be a heightened alert to keep the blood sugar levels absolutely under check. So these patients are advised to check blood sugar levels correctly, and if blood sugars are not under control, to alert their healthcare provider and to flag this to them so that they can tweak the medication. So we should treat this on war footing. We should treat this as an emergency as far as the diabetic patient is concerned, and our diabetic patients are in war with the COVID. So therefore, we need to dispense all the resources that we have, meaning that we should check more frequently. We should adjust the doses of insulin, for instance, or medication if need be, more aggressively. And the idea is to keep the blood sugars very well controlled. And to add to that, I would advise my diabetic patients to be physically active, to exercise at home in an homebound manner, even if they are under quarantine or they are homebound. All of us are. So the time should be best utilized to stay physically fit, to do as much and whatever the healthcare provider has advised in terms of physical activity. Because every diabetic cannot do all exercises or cannot do anything and everything that works. Rather, they should keep the advice given by their healthcare provider, because it has to be in an individualized manner. But generally speaking, I would strongly advocate that our diabetic patients be as physically active as possible. So therefore, keeping themselves fit, keeping their immune system charged up. And also, I advise taking liberal amounts of vitamin C. So from citrus fruits, that is if they are allowed to. If they do not have a kidney problem and there are no contraindications to taking vitamin C, which can come in abundance in citrus fruits, or vitamin C tablets are available. So these things can be taken on regular basis, but on advice of the healthcare provider. But this is something as a general rule we can all follow. I think once afflicted by corona, I'm sure speaking from India, fortunately, we still have some amount of protection as what it seems, because our numbers are not as high as other countries. So therefore, we are fortunately quite safe. But having said that, these things could change. So our experience in treating diabetic patients with coronary diseases is very limited or zero, but it is always possible to intuitively or hypothetically say that earlier we understand or diagnose the coronary infection, the better, because we will be able to treat these patients more effectively, make sure that they do not go into moderate or severe forms. It is those forms that we address. The mild to moderate ones can easily be treated from our colleagues who've been treating the infections, and they've all been putting forth their experience, which has clearly stated that the mild ones can be easily treated, and when we treat these disease early on, a lot of them do very well. Very few of them actually adapt into moderate or more severe forms, which is what we dread. So therefore, I don't think, between a diabetic and non-diabetic, these facts vary or differ, because when it comes to that stage, it is one size fits all. Everybody needs to be treated as it fits the disease. And having said that, during these times, the blood sugar control will be very, very important, because some of the medicines being used early on as steroids, some of the other agents potentially can increase blood sugar levels. So therefore, it is important right from word go to intensify glycemic control, to make sure that the blood pressure is adequately controlled, to make sure that the cardiac state is good and they don't succumb because of cardiac problems that can ensue in these patients, etc., etc. So generally, it is the same, approach, but in a more intensive, it has to be at a war footing in our patients. That is how one needs to look at it.